My name is Dr. Hitesh Amin. I'm the Medical Director of the Bariatric and Weight Loss Center here at Doctors Community Hospital. While there's not one generally accepted definition of obesity, the definition of obesity that I like is that obesity is a disease of excess fat storage. So the important parts of that definition are that number one, it's a disease. Number two, that it involves carrying too much body fat, not simply just a number on the scale. Several individuals can be large, but may have lots of muscle. But those who carry excess fat are unfortunately susceptible to other disease processes. We call those comorbidities. And that's the real problem with obesity. Obesity puts individuals at risk for other medical problems we call comorbidities. Those can be things such as diabetes, hypertension, high cholesterol, heart disease, and many others. For those people struggling with obesity and have had a diagnosis, the most important thing to do is to start educating yourself. Understand what obesity is, how it affects your overall lifestyle, and of course, seek treatment. Treatment spans from self-directed programs such as diet, exercise, lifestyle change. It can involve medical management with drugs and other pharmaceuticals. And for the most severely affected individuals, treatment can involve surgery. Doctors Community Hospital has a multidisciplinary obesity treatment program. We can help individuals with the earliest levels of obesity all the way to individuals with morbid obesity. We have specialists in multiple areas of medicine, including diabetes management, pulmonary specialists for sleep problems, and of course we have surgeons on board that can help with obesity surgery. Bariatric surgery, also known as weight loss surgery, is essentially a set of operations that help individuals lose and maintain a healthy weight. As with any surgical procedures, bariatric surgery does carry some risk. Fortunately, over the years, the risk has minimized significantly. And now we consider bariatric surgery to be as safe as any other operation that we do in the United States. The most common risks people would be worried about are things such as bleeding, infection, possible accidental injury to other organs. However, most patients, 99.9% of the time, have a very good result and experience no complications whatsoever. Bariatric surgery can be divided into essentially two types of surgeries. One type of surgery is restrictive surgery, where we simply reduce the size of the stomach. The other type of surgery is known as malabsorptive surgery, where we actually change the length of the intestine so that patients can't absorb as much food. Overall, patients will come in and be evaluated, and we will determine in the clinic which procedure is best for the patient. All patients that are considered to be appropriate candidates for weight loss surgery will have to go through medical nutrition education, medical screening tests, and of course they'll have to be cleared by psychology or psychiatry. All patients who want to have bariatric surgery must undergo preoperative testing and clearance. They can fall in several categories. First are medical tests, which would be things such as an ultrasound or maybe a sleep study. Other patients will need medical consultations, such as by their cardiologist, and still other patients will need clearance from highly specialized individuals. Regardless of what tests patients need, our program is designed to evaluate each patient individually and order the appropriate tests. Most bariatric operations are under 2 hours of surgery time. Of course, patients will be 100% under general anesthesia and will have no awareness of the operation. Bariatric surgery patients typically will need to spend one overnight in the hospital. after which they'll spend a week to 2 weeks at home recovering. After bariatric surgery, most patients will need to be on a limited diet, mainly liquids for the first 2 weeks, after which we'll slowly ramp you back up to your regular diet. After all of the healing has occurred, patients can resume a normal diet after bariatric surgery. At Doctors Hospital, we do all of our surgery laparoscopically, so we minimize the amount of scarring of the abdomen. There will always be scarring after any type of surgery, but minimally invasive surgery or laparoscopic surgery have the fewest scars both internally and externally. The most important thing a patient can do after surgery to help their recovery is to be up and ambulating after surgery. We know that most complications occur when patients remain in bed for a significant amount of time. In our program, we encourage patients to be up and ambulating the same day as surgery, and most patients are home the following day. Bariatric surgery is covered by most major insurance companies and Medicare and Medicaid. At Doctors Community Hospital, we have a comprehensive weight loss center. We have preoperative assistance where patients will go through nutrition counseling and social support. And after surgery, we have a support group where patients who have had surgery will be able to come together, learn from each other, and have access to support.